Welcome. This is Mental Health Matters. Once again, our collective attention has been turned to the most recent horrific mass public shooting, this time in a high school in Parkland, Florida. Events like this bring to the fore important discussions about what action we can take to prevent such tragic attacks. One of the most common topics of discussion is that of the shooter's mental state, and questions about what can be done in the field of mental health to decrease the risk of attacks like this in the future. Now, in this installment, I will address some of the important aspects of this discussion. Broadly speaking, there are two general approaches. The first comes from the notion that no one in their right mind would or could commit such a horrific attack, so therefore the perpetrator must be mentally ill. The other approach argues that the vast majority of people with mental illness are not dangerous to society. In fact, they may be more likely than people without mental disorders to be victims of violence. And turning the focus of mass shootings to mental health, these people argue, stigmatizes mental health as a whole. The thinking goes, if people are afraid that getting diagnosed with a mental disorder might label them or associate them with those who society considers to be dangerous, then those people may be afraid to seek professional help when they really need it. I think an important place to begin is with a discussion about some of the various categories of mental disorders. The Diagnostic and Statistical Manual of Mental Disorders, which is known as the DSM, contains within it hundreds of disorders that fall under roughly 20 broad categories. These disorders range from some of the more common, like depression and anxiety, to psychotic disorders, where people lose touch with some aspect of reality, to personality disorders, substance-related disorders, and various disorders of brain development. Believe it or not, even restless leg syndrome is considered a mental disorder. So clearly then, the vast majority of mental disorders have no component of abnormal behavior that might pose a threat of violence or danger to others. Nevertheless, there is some data to suggest that a significant number of those mass shootings are committed by people who are suffering from paranoid delusions, also known as persecutory delusions, and/or they may be suffering from depression. People who suffer with paranoid delusions may believe that others are out to get them, and that the world in general is dangerously unsafe. They may also hear voices telling them to harm themselves or others, and they may feel that following those instructions is the only way to rid themselves and find some relief from those voices. With regard to depression, it is unclear what role, if any, it may have in any given attack. Now, one thing I have not mentioned, but certainly should be included in this discussion, is substance-related disorders, particularly alcohol abuse. Some estimates suggest that around 40% of all violent crime is committed by someone under the influence of alcohol. Now, there's also a category in the DSM known as personality disorders. These are enduring personality patterns that are dysfunctional. There is one that is strongly associated with some criminals called antisocial personality disorder. Now, contrary to popular belief, people with this disorder are not the extremely introverted type who prefer to withdraw and isolate from social settings. People with this personality structure show a pervasive pattern of disregard for and violation of the rights of others. These may engage in illegal behavior. They may exhibit deceitfulness, sometimes for a personal profit or just for pleasure. They may be highly impulsive and irresponsible. They may be irritable and aggressive. And they may recklessly place themselves and others at risk. Importantly, they also might show a significant lack or complete absence of remorse for any harm that they cause others. Often, these individuals are only diagnosed after they have had contact with the criminal justice system. So what can we conclude? Do mental disorders or mental illness in some way cause someone to become violent? Well, the answer in most cases is that we really don't know. But one thing we do know is that the vast majority of people with any given mental disorder, including schizophrenia, bipolar disorder, depression, and even substance abuse, are no more violent than the average person and may not only be less violent, but may have a higher likelihood of becoming a victim of violence. Furthermore, while mental health professionals are trained to assess and to diagnose mental disorders, we are not particularly good at predicting dangerousness. Given what I've discussed in this video, that actually makes sense. If mental illness is not a good predictor of violence, mental health professionals should not be expected to be good at predicting who will commit a violent attack. Now, a final point about psychiatric medication is in order because many people have questioned the possible role of certain medications in some of these acts of violence. The most important thing to bear in mind is that an association is not the same as a causation. People with a tendency towards aggression and violence may take medications to help ease those feelings and those emotions. Those people might at times act on impulses despite the medication, or because the medication that they may be taking has not yet been fully effective. But that is not at all the same thing as saying that the medication is the cause of those behaviors. Nevertheless, in a small percentage of cases, some people who take psychiatric medication have reported increased agitation, impulsivity, and violent urges from certain medications. These are side effects that are usually closely monitored by the prescribing physician, who is often a certified psychiatrist, so that such concerns can be addressed immediately. Thank you for watching today's edition of Mental Health Matters, and for doing your part to fight the stigma of mental health problems. Stay tuned for future installments of Mental Health Matters for accurate and reliable information about a broad range of mental health topics. Your feedback, questions, and comments are welcome. Please visit me at drdbrownstein.com, facebook.com/drdbrownstein, or at drdbrownstein on Twitter. Remember, mental health matters.